Today we're looking at eyelid aging. What are the common symptoms and when are non-surgical treatments like tear trough fillers beneficial, and when is it better just to take the plunge and have eyelid surgery, also known as blepharoplasty? My name is Dr. Julian De Silva. I'm a board certified facial cosmetic surgeon and my practice is based in central London on Harley Street, and I specialize in only facial procedures, both surgical and non-surgical. I'm also passionate about informing patients and people about different kind of procedures and anatomy so you can make a better decision for you. What do most people notice around their eyes? Well, classically, they look in the mirror, they feel they look more tired. And many of my patients have tried various creams that promise a lot, but often they don't deliver very much. They might promise like smoothing out the lines and wrinkles, but generally most of these creams, they just hydrate the skin, so they have little effect in that way because it's the anatomy that changes with time. Thinning of the skin, loose skin, puffiness related to the fat, and skin creams only touch the very surface of the skin. So this younger person, well, what we can see is there's some eyelid asymmetry. There's a little bit of loose skin around the left upper eyelid, and it's different to the right side. More noticeable to this patient was this darkening beneath her eyes, these kind of dark circles or a shadow beneath the eyes. And in medical jargon, this is sometimes called a tear trough or the junction between the lower eyelids and your cheeks. This patient has another 20-30 years and there's a lot more loose skin in the upper eyelids. There's puffiness, there's fat creeping forwards in the eyelid. And in the lower eyelid, well, there's some loose skin, even though this patient's not smiling, and that darkness or shadow under the eye is a full ring beneath the eye and a real depression. So there's kind of an elevation with puffy fat and then a depression underneath that. But what can we do about these? What are our non-surgical options? Well, when it comes to loose skin, and it has to be millimeters, we can use laser resurfacing, we can use plexer, and those techniques have mild effect on mild loose skin. So for this patient, well, they're not really going to add much value because this patient has more than a few millimeters of loose skin. However, for milder changes, these changes can sometimes be a benefit. Puffiness is related to fat creeping forwards, and in this younger person, it's quite mild puffiness. And of course, in this patient with more aging, there's just more puffiness creeping forwards, both in the lower eyelid and also in the upper eyelid. And really, this is not possible to treat with non-surgical treatments because as of yet, there is nothing that can take away this fat non-surgically. Even though there are treatments like injecting fat dissolving medicines in the neck and sometimes elsewhere in the body, this isn't a safe area that these can be injected because this fat goes behind the eye, and so one has to treat this with more delicate precision. What about the shadow under the eye? Well, if you're a younger person and that shadow is relatively mild, filler can be an option. Fillers are made out of a substance called hyaluronic acid, HA fillers, and this is a complex carbohydrate that exists naturally in your skin and in joints, and this can be put into these areas where there's a little bit of depression. What about wrinkles? Well, wrinkles specifically associated with movement, and this patient is not smiling, but commonly in this area you get like fine lines around the eye area, the outside of the eye. These are often termed crow's feet. Botox treats these lines beautifully, and really there isn't yet like a surgical alternative to this. And this can be helpful in all age groups, younger and more elderly patients. Botox can work very well for these kind of lines associated with movement. Well, what about lines associated with sun damage? That might be pigmentation, that might be finer lines in the skin. Well, this is where laser resurfacing can be quite powerful because it can repolish these fine lines, it can stimulate collagen in the skin, and it can be compiled with other treatments such as regenerative medicine, platelet-rich plasma to enhance the resultant effects. So non-surgically, well, we can reduce shadowing with fillers and tear trough. We can tighten millimeters with skin tightening techniques. The advantage being we can deliver near immediate results, particularly when it comes to non-surgical fillers. less so with skin treatments where there's often a bit of recovery, like CO2 laser resurfacing, plexer. There is recovery from this because the skin is a bit pink afterwards, and generally the results from these non-surgical treatments are shorter term, approximately a year. Surgery around the eyelids is termed blepharoplasty, and the advantage in blepharoplasty is we can remove that loose skin. So a person such as this, she had a lot of loose skin around her upper eyelids and puffiness around the fat coming forwards, and so with eyelid surgery I was able to take away that loose skin and open up her eyelids, giving a much fresher appearance. In the lower eyelids, well, again, reducing the puffiness, using fat transfer in this area where there's a depression makes this much smoother and gives a much longer result for many years ahead. So quad blepharoplasty means upper and lower blepharoplasty. Now, how does this correlate to the changes that we can see? Well, loose skin, we can take away that loose skin, and often there's anywhere from 8 to 22 millimeters of loose skin. That's over 2 centimeters. So there can be a lot of loose skin in this area in some patients, particularly hypermobility, things like that. Puffiness, well, puffiness, particularly in the lower eyelid, this could be treated by lower eyelid blepharoplasty. And there are different techniques that can be used, but in medical jargon, transconjunctival blepharoplasty, where it's done on the inside of the eyelid, is very important because that can help preserve the shape of the eyelid, avoid issues and complications. It's very important to do that on the inside of the eyelid. And then shadowing or dark circles, well, whereas in mild changes we can use filler, in patients who have more significant changes, it's beneficial to use fat transfer with eyelid surgery. We can take a little bit of fat from around your belly button, we can concentrate that fat, and then we can put what's very fine amounts of fat into this area under your eyes, and it will make that area smoother and more even. And then in terms of wrinkles, well, when you have more than a few millimeters of loose skin in the lower eyes, well, we can take away a pinch of that loose skin, often anywhere from 8 to 12 millimeters of loose skin, and that will give this area, make it much smoother. And then finally, Botox. Botox is helpful for lines associated with movement, and yet, as at this moment, there isn't a good surgery that will stop those lines associated with movement. There was in the past, like going back more than 10 years ago, but it wasn't a natural result. So Botox still remains an excellent treatment for these lines. And then finally, the fine lines associated with sun damage, aging, well, using a laser, using platelet-rich plasma, sometimes other forms of regenerative medicine, that will really enhance like the skin quality, making the skin much smoother and more even. So, looking in summary, non-surgical treatments, well, they take about half an hour to complete. They have minimal recovery. Often they last for about a year. It is an intricate area, and so for some people, even things like fillers, it just doesn't suit those patients. So quite a lot of patients I see who've had multiple fillers around the lower eyelids, they just end up with puffiness, and that filler has to be dissolved and then treated with blepharoplasty. So it is an intricate area. It's much more challenging to put fillers around the lower eyelids in terms of a non-surgical treatment than it is to do fillers in the lips and the cheeks and other areas of your face. It's just because the skin is so incredibly thin and delicate. Blepharoplasty surgery, well, this takes more like 60 minutes to 2.5 hours. The recovery, well, most recovery is swelling and bruising, and that's over like 2 weeks, but more change happens even over 6 weeks. And it generally lasts for 8 to 10 years. And certainly the lower eyelids, using fat transfer, using some of the techniques I mentioned to you, it can last even longer than that. I've seen some of my patients at that point in time, and it still looks really good. More is achievable with blepharoplasty, and of course, everything in medicine has some rare but serious effects. So non-surgical blepharoplasty, well, what's the really serious risk? Well, it's damage to vision or even blindness. And this is a photograph of imaging behind a person's eye that had filler injected. And you can see this completely white blood vessel here where filler has tracked along this blood vessel and blocked it. The back of your eye is a bit like the film in a camera, in that it gives you sensitivity to light, and if that area is damaged, it just will not see, and that often cannot be improved. it's permanent. Fillers can also cause damage to the side of the nose and other parts of the face through skin necrosis, but that tends to be filler just outside the tear trough area. Why does this happen? Well, this incredible photograph by Professor von Hagens in his Anatomy, where he plastinated every single blood vessel in the human face, we can see this incredible blood supply to the eyelids in the face. So injecting filler into a blood vessel that tracks behind the eye can result in damage. It has to be done in a specific way with high pressure. Where the filler is injected, it travels all the way behind the eye and then it can cause damage to the vision. It's a higher risk area, injecting fillers in the tear trough, because of these serious consequences. However, there are things we can do as doctors, as physicians, to minimize those kind of issues. Cannula technique, using a type of filler that can be dissolved. I have another presentation looking at this, but in a way, it's very important that the person doing your filler in this area has a filler antidote, and that's called Hyalase, because that needs to be administered urgently if there was to be anything like this. And if it's delivered urgently, then there's a reasonable chance it will dissolve that filler and the side effect will go away. However, many current practitioners, particularly in the UK and many parts of the world, they don't have to be a doctor or have medical qualifications. And because this is a prescription medicine, you have to be able to write a prescription in order to deliver and receive this medicine. So in blepharoplasty and non-surgical treatments, there are some fundamental differences. The benefits from non-surgical treatments are really if you have very mild loose skin, a mild depression and tear trough area, and these tend to be younger people, and filler can be used very effectively to just soften mild changes. Using CO2 laser, using Plexer to tighten the skin, well, often this is not quite adequate, and many patients are a little disappointed because it doesn't tighten the skin quite enough, because those procedures are often result in some recovery because they make the skin a little pink. The advantage of blepharoplasty are we can treat patients who have more loose skin. If you have more of a depression under the eyes, fat transfer can be used. And of course, if there's puffiness, whether it's the lower eyelid and the upper eyelid caused by fat, that fat can be reduced in terms of the surgical procedure. And of course, it's longer lasting. When it comes to eyelid procedures, they absolutely need to be tailored to you, the individual. No universal treatment will work for all people. Non-surgical treatments definitely have some benefits. They have fast recovery. They give you very good results in the right person. Surgical blepharoplasty, well, it can achieve a lot more. You can look 10, 15 years younger if you've got a lot of facial aging, but there's always some degree of recovery from that, and the treatment needs to be tailored to the detail of what you can see. Now, I do hope this has been interesting for you. Thank you so much for watching. Let me know if you have any further questions and I'll be happy to answer them.